Salvatore, so nice to have you with us today. So, we're here at Imagination in Action in Davos 2026. And a lot of the conversation has been centering around thinking about AI in healthcare. But when we get to why we're thinking about AI in healthcare, we recognize that it's really population health. We need to reach more people in the communities where they live to be able to deliver that care. And for that, we have to be able to find people, diagnose them, take care of them. And you and your career and now at Karna are doing exactly that. So maybe will you start by just telling us a little bit about your journey and then how you got to Karna, and then we'll talk about the company.
Sure. First of all, thank you for having me here. What a
Absolutely.
beautiful background. So the journey to Karna Health started about 5 years ago, really around the unmet need around chronic disease prevention. We started with chronic kidney disease, 1 billion people in the world, the prevalence increasing, mortality getting worse, and the costs increasing year after year. And by 2040, it should be the predicted to be the fifth cause of death around the world. And so one is there's lack of awareness.
That's right.
There are lack of specialists around the world. There are lack of resources. So AI can only help. And for us, AI is really, I would say, two main drivers that we're using AI for. One is predictive analytics.
Okay.
In many parts of the world where the disease is poorly understood, environmental and genetic risks. And so identifying who's at risk of disease and then risk of progression is really important. So how do you prioritize the limited resources you have for people that are more likely to progress to end-stage disease?
Absolutely.
And then upskilling, right? Taking
Yeah.
advantage of the resources that are available. So those are primary care doctors, pharmacists, nurses, when a specialist is not available, and sort of upskilling them so they can be able to take care of patients who need treatment.
So when we think about this area of cardio-kidney-metabolic disease, it really needs to be addressed at the governmental level. Have you had luck in speaking with governments and thinking about really not employing this at a private level or at a hospital by hospital level, but getting this into the fabric of how we deliver healthcare? And have there been certain countries that have been population health forward to really think about cardiometabolic disease?
Yeah, absolutely. So fortunately, cardio kidney metabolic disease is becoming more accepted as a real issue. We have had success. I would say we've generally approached governments because you want this to be a national program, a national incentive,
That's right.
because governments reap the benefits of prevention because they're paying for dialysis, or when dialysis is not available, people will die,
That's right.
unfortunately.
That's right.
So we have met with several presidents, vice presidents, ministers of health, and ministers of finance are
Okay.
sort of our champions.
Okay.
So we launched in Bermuda. The very first person on our platform is the Minister of Health of Bermuda. And
Amazing.
then we went to Cameroon. We just enrolled 35,000 individuals into a
Okay.
prevention program, adding 75,000 more
Okay.
in the first quarter of this year. 10,000 in DRC,
Okay.
and upcoming Philippines, Turkey. Yeah,
Now, interestingly, you are mentioning countries, let's take Cameroon, for example, where we don't immediately think of people being digital forward, diagnostic forward, right? We're thinking about communities that may be harder to reach. How are you able to reach these many people in
yeah,
these countries?
yeah. No, it's amazing that this is the wonders of technology with point of care testing and with digital platforms. Really, all you need is a cell phone and a cellular signal,
Okay.
and small devices that are powered by batteries or recharged,
Yep.
and we're able to mobilize teams at healthcare centers. In fact, we did 35,000 lives in about 2 months in very challenging circumstances.
Yeah.
And our goal is, for example, we have a program in Latin America, about 2 million lives, that will enroll over the course of 18 months. So it is possible and very scalable.
So this is something that I want to focus on for a second, and especially for, those who are listening. When we think about being successful at this, it's not just AI, it's not just point of care testing. You're talking about the government being behind it, the people on the ground being willing to understand it and then enact it, patient agency, and having people understand why it is that they need these point of care diagnostics. And then the last part is really bringing the technology to them and using the predictive analytics to get them to the help that they need. And
Yeah.
so I love this. This is an environment. Let's change gears for just a second and think about the kind of startup culture and startup world. There are a lot of investor dollars floating around Davos right now, and everybody is saying, how do I measure impact? And it's interesting because we talk about impact investing. That's one thing. That's almost an assumption that you're kind of like a nonprofit, right? Oh, we just do it for impact. But really, we're getting to a point where even investors want to say, I both want a fiscal return and I want to see outcomes. So for those investors who are thinking about cardio kidney metabolic, I already know why I believe it is the absolute right place to invest right now. But from your perspective, will you just tell us a little bit about that?
Sure, there's probably no other group of diseases that's as bigger return on investment for health economics perspective. On kidney disease alone, every dollar in prevention saves $45 in healthcare savings.
Every dollar in prevention saves $45
Yeah,
in healthcare savings.
That's a Deloitte study.
That's fantastic. And that's not counting missed days of work or
That
employees who aren't there or communities that are suffering because many people are ill.
That's
Okay.
essentially just the end stage kidney disease. It doesn't, the additional ER visits, the lost productivity, caregiver time, those are additional expense, lost taxation,
Yep.
and not to mention what the carbon footprint of dialysis would be in the world as well.
That's right.
So that's the staggering health economics. So it makes a lot of sense. Yeah, we've been fortunate with investors that have, in the last few years have seen what you could do good and also have a return on your investment.
That's
And,
right.
and it's been challenging because population health is generally not one that investors have gravitated towards. But I think this grouping of diseases is one that has been attracting
Well,
investors
I'll
first.
also say that I think technologies like yours that really bring diagnostics to the home, to the individual where they live. And second of all, I think the medical background that you bring. There's such a need for us to partner engineers and technologists with clinicians who also have that experience. And so I would just like to say that I think that's a large part of your success and your ongoing success.
Thank you, and thank you for your mentorship, and it's been great to watch you in action as well.
Wonderful. Well, we're looking forward to the rest of the day in Davos. We'll have some more talks later today.
Great, looking forward to it.
Okay.